Again, today we welcome you to our channel at Love for Bookworm. Today we want to briefly and within a few minutes discuss hypoglycemia. We have talked about diabetes and now we are talking hypoglycemia. What is hypoglycemia? Okay. So, and most people will and may only think hypoglycemia comes when you are diabetic, but that is not true. So you don't only experience hypoglycemia when you're diabetic. You can experience hypoglycemia even when you don't have diabetes or there's no family history of diabetes. So I wanted to make this very clear. You can experience low blood sugar. And some people actually just experience low blood sugar and they never have high blood sugar. And so what is hypoglycemia? Hypoglycemia is often related to diabetes, okay? And yes, if you have diabetes and you're taking diabetic medicine, there's a chance you could have taken more medicine and not eaten, especially for people who take insulin. Maybe you injected yourself and you've not eaten. And so you can end up having low blood sugar if you're taking medicine. Other drugs too, or conditions like other diseases, other symptoms like liver disease, which is like hepatitis, liver cirrhosis, kidney disease, many other things can cause hypoglycemia or low blood sugar. Sometimes if you are not eating, you are sick, you're vomiting, you have diarrhea, you can end up depleting all the glucose within your body and you end up in a state which we call hypoglycemia or low blood sugar. Now, in most cases, we do prefer high blood sugar than low blood sugar because low blood sugar, your blood sugar can get to a point where we can't get it back. Or you get to a condition where even if we give you blood and you absorb sugar, you will not be able to get your condition back. Your brain does not have reserves for glucose, and so at some point you will get confused, things go wrong, unconscious, and you can actually easily die with hypoglycemia if not treated easily. What are some of the symptoms if you will listen to me just for a minute? Some of the symptoms: you can have lots of headache, very bad headache, chest pain, you become very pale, you are shaking, sweating. Sometimes you sweat when you are laying down, weak and dizzy. You lay down and you feel like you are totally drenching in sweat, extremely tired. Sometimes you feel some kind of arrhythmia. Okay, you feel like your heart is skipping or beating so fast, or your heart is kind of irregular. You can have some nausea, you feel like vomiting, or you actually vomit, or you feel something like you're hungry, yet you're not really hungry. Or you may actually be hungry, you feel very tired, and you're very irritable, very anxious. People talk, children are shouting or playing, and you are pretty irritable. You can also have difficulty concentrating. People are talking or there's something you are listening to and you no longer want to listen. Sometimes you can end up with tingling and numbness on your lips, on your tongue, even on your cheeks. Okay? And so these are some of the symptoms. If you experience any of these, you actually need to see your provider or your doctor quickly. And at the end of this video, I will tell you what not to do. When you're experiencing hypoglycemia, I'll tell you what not to do, okay? So pay attention to the end. Now, what are the complications? Now you have hypoglycemia. Now your blood sugar is very low. Now what will happen? You can end up being very confused, okay? Loss of coordination, like you can't even walk. Your speech does not come out clearly. It's called slurred speech. Even your eyes may not be seeing well. You look at everything, it's blurred. Okay. You can actually become unresponsive, unconscious. You can start getting seizures. You actually can end up dying very quickly with hypoglycemia. Now, what should you not do? Now you have very low blood sugar. You have been rushed to the clinic, which our people love to do. You've been rushed to the clinic. They don't have anything to test. They don't have no equipment, nothing for testing. So the first thing you get there, maybe you're very confused. You are sweating, unconscious. They put an IV in. What they should not do, they should not be giving you normoxilin at that point. That's not the first thing to do. They should not be giving you antibiotics. First thing is usually ceftriaxone, gentamicin, all these antibiotics. Shouldn't do that. Now, if you have very low blood sugar, and now I give you 2 liters of normoxilin, what did I just do? Just diluted even the liter that was in there. Okay? So I'll be putting you even in a bigger coma. So you shouldn't start doing antibiotics. Don't start doing fluids. So we start fluids when you are having hypoglycemia. You have lots of blood sugar in your body. And now we need to bring the sugar down. We give you lots of fluids. But now you are hypoglycemia. If I give you more fluids, I will be diluting even the little sugar, and I'll be putting you in bigger trouble. So there are issues and there are situations that you may be so sick, and they do malaria, you don't have malaria, they do this simple test like typhoid and you don't have, maybe they run and do urinalysis. All you need to do right at this moment is not do normoxilin and antibiotics. You need to eat sugar. If you are home and there's nothing else, all you have is sugar. Put the sugar, whatever it is. If it's at the buccal mucosa, inside the mouth, under the tongue, put the sugar in. Okay. If you are at a clinic where you can actually do D50, do D50 right away. If you don't have any opportunity to put an IV, you are having trouble getting an IV in, and you have glucose, get the glucose, push the glucose into the mouth real quick. Whatever you can sugar-wise. And if absolutely there's nothing, you don't have glucose, there's even no sugar, but you have sweet in your pocket, and they are able to chew sweet, let them chew. Candy, sweets, give it to them right away if they can. Okay? If they can chew, let them chew. But at home, at your neighbor's place, there's sugar. Get sugar, put it in their mouth. As you even try to squeeze a little bit to mix it up to dissolve, put the sugar into the mouth. Okay? So I want to tell you one thing. To save yourself, if you have hypoglycemia, do not rush to antibiotics, fluids. That is why it's important to test. If a person is so sick, they are shaking, they are sweating, they are confused, pretty tired, they are actually dizzy, don't assume this is infection. Always test, because you might be killing them in the name of saving them. If you cannot manage a patient like this and you don't know what's happening, call somebody. Refer them to somebody who can save them. Don't kill them before you refer them out. Okay? That is all I wanted you to know. You can actually come to Love for Book for screening. We can manage you better, because as soon as you walk in here in that situation, somebody from the lab will be running, somebody from ultrasound will be running, the anesthesiologist will be running on top of the nurse and the doctors. We always do everything concurrent. When somebody is putting the IV, somebody is testing. So when your patients are so sick, first of all, do one thing: random blood sugar. This should be basic. If you have a clinic that you're going to be putting an IV and do something to any of these people in this community, make sure you have glucometer. At least do random blood sugar before even you do malaria and all the other things. Malaria may not kill this patient now, but hypoglycemia, persistent hypoglycemia, will kill this patient sooner. Okay? I hope you have listened. If you have any questions, again, this is Dr. Sebe here at Love for Bukwa. More to come. But I thank you.